because the way that I wrote this, I actually wrote it in a different order. So if you go to the knee, you start with the patella. So if you can find quadriceps tendon, and you'll find the patella kind of in the middle of the knee. As you locate it, you can find the anterior edge and palpate around and all the surfaces and the edges. You can move it around or not, and then you can actually go down the patellar tendon a bit as well. And as you find the tibial tuberosity, you're going to come from the middle of the patella, and you're going to slide your fingers 3 to 4 inches inferior from the patella and find the tuberosity, which is the prominence on the anterior portion of the tibial shaft. You can do it from here, or you can have them seated, so get you to sit up. Do you want to sit on that? Normally you'd sit in front, but as you come from the kind of medial patella, you'll come down the patellar tendon to find the tibial tuberosity there. And as you keep going, you'll feel the shaft of the tibia. As you go just further distal, you can palpate the whole shaft of the tibia as you get down to the medial malleolus. Next we have the head of the fibula. So with them seated in the knee flexed, first you gotta find the tibial tuberosity. And if you come laterally, and as I said, you can use one finger and palpate laterally, or just use a bit of a C grip, and when you come from that, your thumb should land on the head of the fibula. You can come behind it, you can come to the front of it and feel the joint line. To know that you're on it, you can have them dorsiflex, kind of move their ankle up and down, and you should feel it kind of shift up and down in your fingers. Do be careful when you press posteriorly on it, because you do have the tibial nerve right there, and it can be pretty tender.
But that's okay.
Next, you're going to come to the tibial plateaus is the next one. So with them seated, you're going to come to the patella and slide just distally, and as you come to either side of the patellar tendon, your thumb should fall into a little ditch there, which you can feel the tibial plateaus on either side. So, and you can come to the medial plateau and the lateral plateau. Each one of these, where they sit, that's where your meniscus sit on, menisci. Sit on there. Then you want to continue, and then you follow along the edges of them. And then you have your pes and serenus attachment site. So with them seated, you locate the tibial tuberosity, and you palpate medially 1 inch and explore the flat surface and palpable tendons. So if you come just 1 inch to the side, you'll find a nice flat spot kind of just before you fall in, but it's right underneath the tibial plateaus. And there's a flat spot where there's 3 tendons that attach there called the pes and serine group. Right, cutter, right in there. You can usually feel the 3 tendons because they're kind of shaped like it's a goose foot, which pes and serine means. And you should actually feel kind of 3 tendons all in a row there. After that, you can still come up the epicondyles of the femur while sitting here. So you, while locating the patella, slide directly lateral from the patella to the outside of the knee. And as you come out, you should be able to feel the epicondyle of the knee here if you kind of come straight lateral. If you go medial, you can feel the medial epicondyle here. And right above them, you then have the supracondylar ridges here as well, which never feel nice. But the adductor tubercle is also while they're seated. You're going to find the medial epicondyle, slide superior along the medial side of the femur, No. Because then as you come proximal from that, you'll feel where this kind of ridge dips in. And if you come just behind a bit, you'll feel the adductor tubercle. You try to feel the exact spot where I am.
Yeah.
Yeah. You got it?
Yeah.
Where it comes, you'll feel the shaft come in, so you'll feel all of a sudden the bone kind of get skinnier. And then if you just kind of fall, I usually fall backwards a bit, and you can kind of feel a tubercle right kind of just above the medial epicondyle. It doesn't feel too nice, is it?
No. Got pressure points.
And now we go to the ankle. Okay, lateral and medial malleoli. While they're seated in supine, you can find obviously lateral malleoli of the tibia. Lateral malleoli is the fibula. On the outside, you can find the malleolar grooves, where if you just come off the medial malleolus, slide roughly half an inch posterior, and you'll palpate the posterior aspects for a slender vertical groove. And you can feel it just in there, and you can kind of strum back and forth, and you can feel some of the tendons. And if he actually moves his foot, so if I actually passively invert the foot, you can feel the tendons shorten. You good?
Yeah.
Then you can do the same thing for the lateral malleolus, coming posteriorly. Feel a groove, little groove where some tendons go through, and then if you passively evert the foot, it's the same thing. You can feel some of the tendons kind of move and jump around in there. Then we'll go to the calcaneus and the tuberosity of the calcaneus. So you're gonna have them supine. You're gonna go from the malleoli and walk your fingers distally to the base of the calcaneus. And as you palpate and explore the shaft and the girth of the posterior, move to the plantar surface and isolate the tuberosity at the base of the heel. So as you come down, you'll feel the whole calcaneus here, and as you come to the plantar surface, you can feel the tuberosity right at the bottom. Thank you. It will feel more like a flat region more than a bump, but you can kind of feel the shelf of it if you move a little bit more distal. The tuberosity, yeah. Then you have the sustentaculum tali. So you place the ankle in a neutral position, locate the medial malleolus, slide it. You okay?
Yep. I am just.
Okay.
That's natural for me.
You're going to slide approximately 1 inch distal to the small tip, and you'll feel this little shelf there, which is the sustentaculum tali. And then if you passively invert the foot, you'll soften the surrounding tissues, and you can kind of find and then you can just feel around it to feel all the different tissues that are just distal to it. The fibula trochlea, put the ankle in a dorsiflex position. Locate the lateral malleolus, slide roughly an inch inferior, and explore for a small superficial trochlea. It may feel like a short ridge on the surface of the calcaneus. Passively evert the foot will soften the tissues, and you can then also go around the edges of it to kind of feel all the surrounding tissues. Those are the two like shells on either side of the ankle. You're going to find the head of the talus. So you can do this seated or supine, but we'll leave them like this. You're gonna have the ankle in a neutral position. Locate the navicular tubercle, which is just inside here, which we'll actually find once it gets to the navicular after this. Because I always find it funny that they do this before. Slide proximally off the tubercle to the head of the talus. You may feel like a depression in comparison to the tubercle, and if you passively invert and evert the foot, you'll clearly between these two landmarks, and the foot is inverted, the navicular tubercle will become more prominent, and when the foot is everted, the talar head will be more pronounced. And you can kind of come on both sides of it because you can feel it shift back and forth as you evert and invert as well. And then this one is trochlea of the talus. So get you to lie on your back, which is supine.
Oh my gosh.
Passively invert and plantar flex the foot. Draw a horizontal line connecting the malleoli, so come to the middle. And you'll drop inferiorly, looking for a bony prominence. The trochlea will be deep to the overlying tendons and more prominent near the lateral malleoli, so right around here. And if you move it back and forth, you'll feel it kind of depress and go in, and it'll be under a bunch of tendons there too. So you might feel the tendons over top. The medial tubercle of the talus, you're going to locate the medial malleolus. Instead of sliding straight distally to the sustentaculum tali, you're going to slide just posteriorly, just off the malleolus at a 45-degree angle. As you passively dorsiflex and plantarflex the ankle, you'll note how the tubercle seems to slide around the malleolus. So you'll feel a tubercle that's just kind of down and behind it, and if you move the ankle, you'll feel how it kind of goes around the malleolus. And then we'll start with this trail. It's called the Little Piggies. So we'll start with the hallux. So with them seated or supine, you're going to palpate the entire surface of the first toe, noting the differences in thicknesses and texture between the dorsal and palm plantar surfaces. Explore the surfaces of each joint by passively moving it through its range of motion. So it's meant to come on the dorsal aspect. You can feel from the metatarsal all the way down to the phalange, proximal and distal phalanges of the great toe, or the hallux. You can feel what the plantar surfaces feel like. That was my thumb that cut. And you can just move the toe around itself to feel the different joints. And then come to the first metatarsal. You're going to keep them in this position, seated or supine. Locate metatarsal shaft along the medial side of the foot. And then just make sure as you feel it, explore how thick it is at different portions. Notice how its base feels different from the head. And palpate the junction of where the metatarsal head, sorry, base and head, and where the head connects to the cuneiform. Which cuneiform is it?
First.
Or?
Medial.
Yes.
First.
Then as you go through the second, fifth digits, it literally just says they're the toes. I think they just kind of do them all. So as you go in here, you're just palpating along the different phalangeal joints and interphalangeal joints of the toes. Remember, there are two interphalangeal joints for the toes. Your proximal interphalangeal and your distal interphalangeal, so pips and dip joints. Pips and dips. Then you can also come through the metatarsals from the base all the way to the head. From the metatarsals, just for all of them, it's the same thing. From here, grab your hands and palpate the head of each metatarsal on the dorsal side of the foot. Use both thumb tips to explore the length of each bone and surrounding tissues. Follow the shaft of each metatarsal proximally. Note how it widens to form the base of the metatarsal. I think they're mixed up because I think we said the head is always up here for the metatarsals. Base is always here. The head will be round as well. It definitely said where the head connects to the cuneiform, and I was like, that doesn't sound right. And then you're gonna find the tuberosity on the fifth metatarsal. So you're gonna locate the shaft of the fifth metatarsal. And as you follow approximately, you can feel where the the base bulges laterally and explore the superficial shape of the tuberosity and surrounding landmarks. And you'll know because as you fall off it, you'll come into a lot of like fleshiness, kind of off the lateral aspect. So as you come off that lateral aspect, you'll kind of hit the spot where you can feel it's all just muscle and flesh there. But this is where that kind of base of the fifth metatarsal and the tuberosity is, where your perineals attach. And then we have the archways. So with them seated or supine, locate the base of the first metatarsal. Glide proximally to the skinny ditch of the first tarso-metatarsal joint. Continue proximally onto the surface of the medial cuneiform. Slide laterally from the medial cuneiform along the dorsal surface of the foot and explore the surfaces of the middle and lateral cuneiforms. And just kind of feel all the edges and stuff in there. For the navicular, you're going to locate that base of the first metatarsal. You're going to slide along the medial side, more proximally of the medial cuneiform and the slender joint between the medial cuneiform and the navicular. As you move on to the surface of the navicular, explore the shape and size of the navicular tuberosity, which is right there. And the tuberosity will lie approximately 1 to 2 inches distal to the medial malleolus. Then you'll go on to the cuboid. For the cuboid, you're going to draw an imaginary line from the tuberosity of the fifth metatarsal to the lateral malleolus. And then if you come kind of, it says roughly half an inch from the tuberosity, but it's basically kind of right in the middle, you'll feel the cuboid. And that's all.